Hello and welcome to today's webinar. My name is Mina Niknazemi. I hope that you can hear me and see my screen. I'm going to try to open the chat at the same time as well. So if you have any questions throughout, feel free to pop them in the chat or turn on your mic at the end of the webinar. If you have any technical difficulties, I will be keeping an eye on the chat as well. And other than that, there's some gardening happening outside. I'm going to quickly close my window so that I have a better sound inside. One moment, please. Okay, so this should be better. All right, so let's get started. Right, so you should be seeing my screen with the starting foil Bausch. We make occlusion visible. My name is Mina Niknazemi. I'm a dentist and also OccluSense consultant at Bausch. And today we will be talking about OccluSense. First and foremost, a couple of background facts about Bausch. It was established in 1953, so the family-run company has been in the scene quite a while now. The production site is based in Cologne by the Fühlinger See, a couple of hours outwards. And here you can see Dr. Hans and Dr. Jean Bausch, who together back in 1953 founded the company using them old school printers. And today all of this is happening in an automated way. What we are talking about today is a new method to look at occlusion control. So it's OccluSense by Bausch in a digitalized manner. And what I want you to think about first and foremost is, what is occlusion? Actually, a pretty straightforward question to ask. So I just want you to bear in mind the concepts of static occlusion and dynamic occlusion and how you test this on your patients. So what measurements do you carry through when your patient is sitting on the dental chair? The current standard consists of different papers and foils in differing colors, shapes, forms, and thicknesses, with the standard foil being 8 microns thin. And to test dynamic occlusion in all dimensions, what we currently do is use different colors to try and show us the pathways of the occlusion in the mouth. So you can see that here we are using red for static occlusion, black for protrusional movements, and green and blue for lateral and medial occlusion movements. Especially if this process has to be repeated, this is an extremely time-consuming manner, which is why OccluSense comes into play. So here we have occlusion in a digitalized manner. And you can see in this diagram the OccluSense handheld and a sensor. Due to the asymmetric pins and holes from the sensor and the handheld, there's only one way to put the sensor into the handheld correctly. And once you hear a click when closing the handheld, your sensor is inserted correctly. Once this is done, you can insert the sensor into your patient's mouth and ask them to conduct any movement that you wish for. The data will then be wirelessly transferred to an iPad, where you then receive an output with your data. What you also see here, the marks of the OccluSense sensor, so of the occlusion that you have recorded, are also left on your patient's teeth. So this is not a process that you would need to repeat. The system, as you saw, consists of the OccluSense handheld. You need an iPad produced after 2014. and the OccluSense app, which is available for download on the Apple Store. What you will also need are sensors. So currently available, we have X and XL sensors. They differ in width rather than length. And these sensors are able to detect 256 different pressure levels. Apart from that, they still remain only 60 microns thin and are consisting of thin and flexible material which can be easily inserted into the patient's mouth. And as mentioned in the previous diagram, the red color coating leads to a mark leaving in your patient's mouth when using the sensor. How does OccluSense work? So to get started, this is a short clip of the initial setup. You will need to, and you only need to do this once when you receive your handheld and you want to connect it to the iPad. You have to ensure that you are connected to a wireless connection. And when your wireless connection is in place,
open your OccluSense iPad app. Tap on menu item Settings. Then choose Handheld Registration. Fill in the registration form. Please enter country, name, first name, street, zip code, city, and your email address. Tap the Register button to send your registration data. A confirmation email will be sent to your email address. Open the email and press the Confirm button. If your registration was successful, a green tick will be displayed.
and once the green tick is displayed, you know that your system is registered after the initial setup.
To initiate the sensor test of the handheld has to be connected to the app first. Now go to Settings in the OccluSense iPad app. Having your handheld and the test sensor ready. Now tap on Functionality Test Handheld. You will now be asked to insert the test sensor correctly and to close the sensor flap. Press the pink colored control button to start the function test. The function test starts now. The result of the function test is displayed in the app. Now, remove the test sensor from the handheld and put it back in the storage box.
And this sensor test, or the sensor, the green thing that you see in on the screen, this will be delivered with your OccluSense pack. It's to calibrate the system and to ensure that you receive good quality data each time you're using your OccluSense. The system will also automatically prompt you to do so. So this is not something that you need to remember. After every 10 to 15 uses, the system will tell you, hey, please use the sensor to calibrate me, and then you can do it as simply as shown in the video. To understand why you need OccluSense, I would like to compare checking occlusion of your patient with OccluSense and with normal paper and foils. If you look at the pathway and run from 1 through 2 up to 3, you can see that occlusion consists not only of an initial contact and the final position, so point 3 and 1, you also have something that is happening in between. So the sliding into intercuspidation. And when you are looking at occlusion with papers and foils, you have the possibility to look at only point 3, so the end position of the teeth, which you can compare to a snapshot of one moment in time. So with papers and foils, you have a little snapshot or a little picture, as you may like, of the occlusion at one given moment in time. With OccluSense, however, you have the opportunity to look at this process from point 1, so the initial contact, through to point 2 and point 3 of the entire process. And this is analog to a video recording over time. So rather than only getting an outlook of the occlusion at one single moment, you receive an overview over time. But do we really need that much in-depth information for every single treatment that we do? If we take an implanted construction as an example, we know that the tactile sensitivity of an implanted construction, so a construction that is not within its vital periodont, is about 8 times higher than the vital periodont. This also means that any interferences in the system are much more difficult to diagnose and also to feel by the patient. So an implanted construction would, in my opinion, be one indication where you can use and you should use OccluSense. What you are also able to do is detect hidden contacts. So contacts and hidden contacts that are not necessarily directly available to the patient's to the patient. You can look at interference contacts or detect combined periodontal damage due to incorrect loading quite early on in the process. What you can also see is a force distribution in percentages of your entire dental arch, which can lead to chipping avoidance, and look at occlusion on splints. What you're also automatically doing is using this output for patient education and documentation, because occlusion is quite a hard concept to explain to patients who are not from the dental field. And using this visualization can really help them understand what is happening. When you're using OccluSense, you have a database with your patients, and if the patient has not been added to the database yet, you would need to add them to your database by using the add button and then adding their data. So first, last name, gender, and so on. You have the opportunity in this process to use the patient number of your patient in your CRM system so that you can individually trace them back without a doubt. Once your patient is added in your system, you can activate them or look at past recordings, so they will be saved into your database. And then you have the opportunity to tap New Recording, where you will then be prompted to adjust the time and frequency of this recording. So how long should the recording be? In what frequency are the measurements being taken? And then you get started. You can either prompt your OccluSense to start via the iPad or you use your handheld. Here you see a clinical example of the patients measured with OccluSense. So the sensor is inserted, not exactly parallel, but a little bit shifted into the patient's mouth. And then you construct them to conduct any movement that you would like to have recorded. So here we have first static occlusion and then going into lateral protrusion movement straight away. What you can also see in this recording is a live output of the OccluSense reading. And then I will show you how the markings are also left in the patient's mouth. So any adjustments that you are now looking to do, you can directly do without repeating any steps. As mentioned earlier, you are also able to start a recording using your handheld, but the seconds that you selected beforehand, they won't be necessarily starting when you are pressing the button, because the sensor automatically detects when a pressure change is being applied to your sensor, which is the time when your recording will then start. And for more options such as live and recording mode, you can read them up on the manual. The instructions for use are uploaded on the OccluSense website, ready to download in different languages. As you saw previously, the OccluSense output, so the reading, consists of different colored columns. And what I want to talk to you about now are the pressure and the size of the contact points. So if you have low columns, you have low pressure. If you have high columns, you have high pressure. Very simple and straightforward. The color of the contact points tell you more about the surface area of the contact. Green means we have a more wide area contact. Orange and yellow are something in between, so a smaller area, and red are the smallest, so they are punctual contacts. To try and visualize this a little bit more, I want you to look at the load of this bridge that is being carried by those two pillars. So you see on the left-hand side, a pillar with a wider contact surface to the ground. This is why it's characterized in green. So we have a wider surface touching the ground and applying more pressure to the ground. On the other side, you have a punctual contact by the pillar being applied to the ground, which is why now we have a red column. The amount of pressure that is being applied to the ground is exactly the same, which is why the height of those columns is the same. The only difference that we are seeing here are the colors of the columns. Another unrealistic bridge to try and visualize this a little bit more. You can see that the smaller pressure areas have been changed in column height, and the punctual contact surface is red. How do we now apply this concept to the teeth, so to a clinical case of our patients? If you imagine that you're standing on a plate covered with needles barefoot, apart from the pain that you are sensing at the beginning, what you do actually feel is that the needles that press into the sole of your foot are applying different amount of pressure. And what OccluSense does, or the pixels on the sensor more, what they do, they compare each other and look what the neighbor is doing. So if one of those needles on the very left-hand side on that plate of needles has a very high pressure being applied to it, you can see that the needle is going down more. And next to it, you have a needle that hasn't got a lot of pressure applied to it. And if you then compare those neighbors to one another, you can tell that because there's only punctual needles that have a big amount of pressure being applied to them, this is a punctual contact. Whereas if you go to the right-hand side of the green color, you can see that the pressure that is being applied to those needles is roughly similar, which is why this is characterized by green. In the dental world, or the world of the mouth, this means that when the difference between contacts is high, we're talking about high spots, we're talking about initial occlusal contacts, or standalone contacts that are not in full intercuspidation. When we're looking at the green columns, we know that the difference between those contacts is low, and this is the case for planar contacts, for example, on abrasive teeth, areas of contacts with similar pressure, and so on. The other colors are merely an indication of something that is happening in between. And you need to constantly remember that those colors or pixels on the sensor are always being compared to one another. So if we now take this example of static occlusion of OccluSense and try and analyze this ourselves, then we can see, all right, in the two-dimensional view on the left-hand side, there's no red contacts in the right molar region. So we could think, right, so there's no high pressure there. But actually, if we look at the percentage scalings annotated by the scalings around the dental arch, we can see actually 23 and 21%, that's 44%, nearly 50% of the entire pressure of this dental arch are located right there. So actually, only because we don't have that many red spots there, it only means we don't have punctal contacts. But the total pressure that is being applied here is actually quite high. So we need to remember that red is only a color. It doesn't mean alert necessarily, but just that we have a punctual contact there. And the same level of information you can deduct from dynamic movement. So here you can see lateral protrusion to the right-hand side, and then going back to the left. Some quite helpful features that I also want to talk about quite quickly are the viewing options that you can amend. So you can go from a two-dimensional view over to a three-dimensional view, or look at both at the same time. So this is more of a preference thing, whatever is easier for you. And next to the amendments of the viewing options, you can go into full screen mode. You can twist and turn your diagram using your fingers, and also pause, speed forward, rewind, as well as do some noise cancelling. So I did mention 256 pressure levels beforehand, but if you want to focus on maybe only the main aspects of the occlusion, you can actually go ahead and look at less pressure levels. You can look at percentiles and quartiles, and also compare recordings that you have taken for this patient over time. So if we've fitted a splint and the patient comes back 6 months later, we have the possibility to compare those two recordings after 6 months to one another. This was just a annotation of the noise cancelling. Let me go back to it because that my finger was a bit faster. One moment. Here we go. So this is the noise cancelling just in a simplified form. So you can see that if you are looking to change the pressure levels or the amount of pressure levels that you want to see in your recording, then this is what you are filtering. You also have the opportunity to export your data. The only thing that you need to remember is you need to be in full screen mode to export any kind of data, whether you want to export a PDF snapshot or you want to export an entire video. It needs to be in full screen mode, because only in full screen mode the export button will appear, and then you have the opportunity to export either using a PDF document or a PNG picture, which is then saved to the camera roll. And when you want to export a video, the only difference would be to press play. And when you press recording, sorry, that's the red circle. And when you're pressing recording, if your audio is approved, then you have the opportunity to add some spoken comments onto this recording as well, which will then be exported as well with the file, and then automatically be saved to the camera roll. For the network access guide, you can download this also on the OccluSense website to try and connect to different servers and so on. To clinically interpret the data, you need to take the sensor and then look at the bottom. There you can see a red triangle. Sometimes it's a red line, mostly it will be a red triangle. And this is the midline in your patient's mouth. So you need to ensure that when you are inserting the sensor into your patient's mouth, this triangle or line, whatever it is in line with the midline in your patient's mouth. And once this is ensured, you can deduct this information from your OccluSense reading as well. As you can see that the red triangle has also been added into the reading. And once this is in line, you have segments with those lines that you can see in the red, in the black segment, which then show you exactly which contact point belongs to which reading on the OccluSense app. Here is an example of static occlusion. In blue, you see a regular occlusion on a molar. The orange circle shows a regular occlusion on a premolar. And the purple circle shows a premature contact. Why do I know this? Not just because it's annotated here, but if you look at the middle image, you can see that the quartile on the left-hand side in the molar region is orange. This is already very quickly an alarm signal for me. And when I then look at the percentage scalings next to that quartile, I can see that 50% of the entire pressure is located right there. So that very, very quickly raises my attention. Well, if I now look at the OccluSense reading, I see, yeah, we also have high pressure as well as some punctual contacts. But looking at the clinical image on the left-hand side, I see that I have a premature contact on tooth 36 or a buccal contact, which has nothing to do there. The same information you can deduct from lateral protrusion or any other dynamic movements that you want to have conducted to try and very quickly identify premature contacts. This is a clinical case where in the initial situation, you can see that this female patient has quite a few restorations in place already. She presented herself with a ringing in the ear, the feeling of absorbent cotton, some cervical spine sheath prolapse, but also an hyperactive thyroid gland, as well as muscle tension in her face, and especially within the nose and the ear. When looking at her occlusion with OccluSense, we very quickly identified a premature contact on 48, some unequal loading in intercuspal position, and final heavy loading between 41 and 45. So the OccluSense images are snapshots of those. When looking at the protrusion, we can see parafunctionality on 48, still persevering. And mediotrusion to the left-hand side showed us no canine guidance, but still the parafunctionality on 48. And on the right-hand side, we have a persisting parafunctionality on 48 and 43. The Bruxer movements, however, moved mainly over 43, however, still some persevering parafunctionality on 48. And nocturnal movements showed us that in centric position, we still have a premature contact on tooth 48. So a very, very slight amendment of her occlusion, which included the fabrication of her static occlusion in the first place. So taking out the 48 premature contact in her centric position led to a severe bettering of her symptoms that she presented herself with at the beginning. The second case, so as a foreword to this case, we don't always need a, just one moment, sorry. We don't always need a symptom to use OccluSense in order to analyze our patient's occlusion. So for this patient, it was her very standard dental checkup. And because we were quite excited to use the OccluSense, we just used it to look at the occlusion and especially her pressure distribution. And interesting in this case, because she had quite a few restorations, so a lot of prosthodontics being done, it's actually quite important to try and ensure that her occlusion is roughly evened out. As you can imagine, some of these restorations are on unvital teeth, and their tactile sensitivity is not the same as the one on vital teeth. As you previously saw, there's also the possibility to look at the occlusion in a dynamic way. And for this patient, this was actually everything looked very evened out and good. The protrusion was also fine. So in 6 months, when she's coming back for her dental checkup, we can look at her occlusion in our database and see that it was all standard if we do want to compare it. The final case I've brought for you today consists of OccluSense and splint therapy. So if you look at the condylar processes of this patient, you can see on the left and on the right-hand side, they actually differ quite vastly. And in this case, we have a case of hemimandibular hyperplasia. This was actually a surgery case. So she was in close contact with the maxillofacial dentists or surgeons as well to try and look at more of a causative solution for her problems. But she decided against the surgical option, which is why we then decided to fit a night guard first and foremost to protect the teeth and the mandibular joint. If we then look at the static occlusion without the night guard, so this is her occlusion without any night guard fitted. I'm going to rewind this. You can see that she has an open bite on the left-hand side. So this is the beginning of her occlusion. So this is static occlusion, no night guard. She only has contacts in the right molar region. And when the bite advances, we have more contacts sliding into place. You can see this a little bit better here. When the night guard is fitted, you see that there's a maybe 2.5 millimeter gap in the molar region. And the aim of the night guard to protect her joints and her teeth is obviously a little bit harder here. If you now think about how you usually fit a night guard in your dental practice, for us, we use shim stock foil and we ensure that when we are pulling out the shim stock foil in every area of the dental arch, we receive roughly the same resistance. This is actually quite a subjective method to measure the occlusion because the pull that you're applying when pulling out your shim stock foil with every pull is different. You're not doing it the same every single time or measurably the same. And every dentist will use a different force when pulling out the shim stock foil. And also the resistance that you feel is not synced either. So a very subjective method to test the occlusion. I mean, up until now, we haven't had anything better, but it's quite a subjective method. And when you are doing this, and let's imagine we're doing this in this case, the only thing that we see, if you remember the analogy that I showed you earlier, we receive only a picture, so a snapshot in time, right at the end of the static, I call it movement. So if we here look at our foil being pulled out everywhere within the dental arch, we should receive roughly the same resistance. What we are missing, however, when we are doing this shim stock protocol, everything that's happening before that. So as you can see here, we have a very, very unequal load of the occlusion. As the bite advances with the splint, we gain a roughly evened out image at the end. However, all of this led to her still suffering from joint pains and mandibular muscle pains and tension when she came back for her checkup after we had fitted the night guard. And the same you can do for any kind of dynamic movement. So here you can see the canine guidance. The splint had not been fabricated for the dynamic movements in the first session. So this would have had to be done here as well because this is not balanced out either. And protrusional movements, as you can see here. The most relevant question maybe for today, does OccluSense replace the articulating paper or foil entirely? I would say it really depends on the indication. So the algorithm that I suggest is to, if you need a snapshot of one moment in time, you use your papers and foils. If you're looking at a complete overview of the three-dimensional process of occlusion and you need more a video of that moment, then you use OccluSense. And when you are using OccluSense, you use it at the beginning to visualize all the premature contacts, check them, look at the pressure distribution, do your fine adjustments with your papers and foils, and then check your final result with OccluSense again. You're always automatically documenting everything as well. So nobody can knock on your door and tell you that you haven't done anything properly when you have the documentation as well. We've had some very positive feedback, not only from dentists in Germany or experts in Germany, but also all over the world who have used OccluSense for a lot of different indications. So next to implant prosthetics, which I touched base on in one of my slides, there's also a lot of work being done on CMD, on prosthodontics, but also on conservative dentistry with professionals in Turkey, France, Spain, as well as Brazil, using OccluSense up until today and not being able to um, go their dental daily practice without it. To get started, what you need is an Apple iPad. So as mentioned, supported versions are produced after 2014. You need an iPad app, which you can download on the Apple Store and select different languages as well. A Wi-Fi connection as well as the OccluSense system BK5000, which consists of the docking station, a few test sensors, then sensors that you can use, and the manuals for use. And with this, we have reached the end of today's webinar. Thank you very much for your attention. If you would like, you can note down my email address. If you have any practical questions regarding OccluSense, regarding any cases, please feel free to drop me an email. And for today's webinar, I am open to answer any questions that have arisen within this webinar now. You're very welcome. if there's no more questions open, I suggest that you note down my email address. Maybe once you have tried the handheld in the system, some questions may arise for specific dental cases or when using OccluSense. So feel free to drop me an email or connect via LinkedIn and drop me a message there. Other than that, I hope that you have a lovely weekend. Thank you very much for your time today, and I wish you all the best. Goodbye.